A woman in Ohio reported something her doctor couldn't explain. Her cat, an 8-year-old tabby that had spent most of its adult life ignoring her beyond me, began following her from room to room 3 weeks before a pregnancy test confirmed she was expecting. It stopped sleeping at the foot of the bed and started sleeping pressed against her stomach. It refused to leave her side. She wasn't showing. She had no symptoms. The cat knew something her own body hadn't told her yet. Dismiss it as coincidence, and you run into the same story told by thousands of people across dozens of countries. Different animals, different species, same behavior change, same timing. Before the test, before the symptoms, before any human in the room had any idea. Something is being detected. The question is what? Start with what pregnancy actually does to the human body in the first days and weeks. Most people think of pregnancy as a visible condition. A growing belly, fatigue, morning sickness. Those are late signals. The biology starts changing immediately after conception in ways that are completely invisible to human senses but leave a chemical signature that saturates everything around the pregnant person. Hormone levels shift within days. Progesterone climbs. Estrogen climbs. Human chorionic gonadotropin, the hormone that pregnancy tests actually detect, begins appearing in the bloodstream before it ever reaches concentrations high enough for a test to catch it. The body changes its temperature regulation, shifts its immune response, alters the chemical composition of sweat, breath, and skin oils in ways that are measurable in a laboratory before they are noticeable to any human in the room, but not before they are noticeable to the animals in the room. A dog's sense of smell operates at a sensitivity level that most people have heard, described but few have genuinely processed. Humans carry roughly 6 million olfactory receptors. A dog carries up to 300 million. The part of a dog's brain dedicated to analyzing scent is proportionally 40 times larger than the equivalent region in a human brain. What that means in practical terms is that a dog can detect a scent concentration roughly 100,000 times lower than the threshold at which a human registers anything at all. A dog doesn't smell what you smell. It smells the individual components of what you smell, separated, identified, and processed simultaneously. When a dog smells a person, it is reading a detailed chemical biography that includes hormonal state, immune status, recent emotional history, and metabolic changes too subtle for any human instrument outside a research laboratory to detect without specifically looking for them. The hormone shifts of early pregnancy are not subtle by a dog's standards. They are loud. Cats operate differently but arrive at a similar capability through a different route, where dogs lead with scent. Cats layer scent detection with a sensitivity to body temperature and behavioral micro-changes that most owners never consciously notice they're producing. Core body temperature rises slightly in early pregnancy, not enough to feel feverish. Enough that an animal that sleeps pressed against a human body every night registers it as different. A cat that suddenly gravitates toward a person's midsection isn't performing a mystical pregnancy diagnosis. It's following warmth to a source that has quietly changed. Cats also read behavioral signals that the pregnant person themselves may not have consciously registered. Changes in gait from early shifts in center of gravity. Differences in breathing pattern. Altered sleep movement. A cat that has spent years mapping the precise rhythms of a human housemate notices when those rhythms shift. There is a layer underneath all of this that research in medical detection animals makes harder to dismiss. Dogs have been trained to detect cancer, Parkinson's disease, and oncoming seizures through scent alone, often before clinical instruments confirm the diagnosis. The mechanism is the same one operating when a pet dog begins behaving differently around a newly pregnant owner. It's just untrained, spontaneous, and pointed at a different biological event. In 2019, researchers studying dogs trained for medical scent detection confirmed that the animals could distinguish between blood samples from pregnant and non-pregnant women with an accuracy rate that outperformed standard early detection testing in several trial conditions. The dog wasn't guessing. It was reading a chemical signal as clearly as a human reads a word on a page. Which brings everything back to that cat in Ohio pressing itself against a stomach that held a secret its owner wouldn't discover for another 3 weeks. It wasn't psychic. It wasn't displaying loyalty or intuition in any mystical sense. It was doing what millions of years of sensory evolution built it to do. Reading the chemical and thermal landscape of its environment with instruments so far beyond human capacity that the results look, from the outside, like magic, the pregnancy was already broadcasting. The cat was simply one of the only creatures in the room with the equipment to receive the signal. We built laboratories and tests and medical instruments to detect what our bodies can't register directly. Animals were born with better tools than anything we've managed to build.